Hello everyone, welcome back to Sowkya Medvision. Today we are going to discuss the another norma of the skull, the norma frontalis. We have completed discussion on the norma occipitalis and the norma verticalis. Today we are going to discuss the bones, sutures and some important features of the norma frontalis. See, now first of all let us discuss in the diagram and we'll see in the diagram, then we will see the description of this norma frontalis. Yes, let us know what are the bones that are going to form the norma frontalis. There are three major bones. What are they? The big large frontal bone and the two nasal bones, one maxilla bone, mandible bone, and either side zygomatic bone. This is the frontal bone, right? This is the frontal bone. These are the nasal bones, the maxilla, the zygomatic bone and the mandible bone. What are the sutures that are present in the that are involved in the formation of norma frontalis? The main sutures are four. What are they? Frontonasal. This is the frontal bone, right? These are the nasal bones. The frontal bone meeting at the meeting the nasal bones at the frontonasal suture, and another suture is the internasal suture where the two nasal bones are meeting. Another is the frontomaxillary. This is the frontal bone, right? Yes, this is a maxillary bone. That is a frontomaxillary here somewhere. Yes, and another suture is zygomatico-maxillary. This is a zygomatic process, right? This is a zygomatic bone and this is a maxilla. Here the zygomatic suture is present. See, these are the main bones and sutures that are present in the norma frontalis. There are some more features. Let's discuss what are they. See, these are the eminence. The eminence means what? It is a elevation. It is like a tuberance. Yes, in the last class we have discussed the parietal eminence, which is present in the parietal bone posteriorly. Yes, here we have frontal eminence in the frontal bone. These are the round elevations. And superciliary arch. These are the superciliary arches. And supraorbital notch. The notch present at the superior aspect of the orbit is known as supraorbital notch. And zygomatic bone. This is zygomatic bone, as I said. And infraorbital foramen. This is the infraorbital. There is something like supraorbital foramen and infraorbital foramen. And here we have zygomaticofacial foramen. Here we have zygomaticofacial foramen. And we have anterior nasal spine. There is another spine which is posterior nasal spine. Yes, and the alveolar process of the maxilla. This is the alveolar process of the maxilla. This is the alveolar process of the mandible. This is the alveolar process of the mandible. And another foramen that is present in the norma frontalis is a mental foramen. Yes, that is a mental foramen. Main three foramens are what? Supraorbital foramen, infraorbital foramen and the mental foramen. And the glabella. Glabella is the point where it is the point present in the median line above the supraciliary arches. In between supraciliary arches. Now let's see the description of norma frontalis. In the frontal region, we have squamous part of the frontal bone. This is a squamous part of the frontal bone. Yes, this is a frontal squamous part of the frontal bone. Superciliary arches. These are the superciliary arches, as I said. Glabella. This point is the glabella. Frontal eminence. These are the frontal eminence. What are the main four important features in the frontal region? Squamous part of the frontal bone, superciliary arches, glabella and frontal eminence. And orbital openings. What are they? Supraorbital notch, lateral orbital margin, infraorbital foramen, median orbital margin and zygomaticofacial foramen. These are the orbital openings. And what are the bones that are going to form the norma frontalis? What are the main bones? Are, as I said, frontal bone. This is a frontal bone. Next is what? Nasal bones. The nasal bones. Maxilla. This is a maxilla, right? Zygomatic bone. This is the zygomatic bone. Mandible. This is a mandible. These bones are going to form the norma frontalis. Now, what are the sutures? I said frontonasal, where the suture where frontal bone is meeting the Nasal bones. Internasal, where the two nasal bones are meeting. Frontomaxillary, where the frontal process meeting the maxillary process. And zygomatico-maxillary is the zygomatic process meeting maxillary bone. That is these are the main sutures of the Norma frontalis. What are the other features? Glabella, as I said, it is present between two superciliary arches. And nasal, where internasal and frontonasal meets. This is the internasal and this is a frontonasal, right? This is a nasal. Now, internasal spine, anterior nasal spine. As I said, here somewhere anterior nasal spine is present. Posterior nasal spine is also present, but we cannot appreciate them. We cannot see. Yes, that is very sharply bony projection. And symphysis menti, it is a ridge joining two halves of the mandible. Mandible is formed from two halves meeting at the point known as symphysis menti. And we have something called mental protuberance here. What is a mental protuberance? The triangular elevation. The triangular elevation in the mandible is known as mental protuberance. Now, frontal eminence, as I said, there are the two eminence on either side. For each on either side, see, this is the one eminence, this is the another eminence. So there are two frontal eminence which are rounded elevation above superciliary arches. And what are the three main foramens? Supraorbital foramen, infraorbital foramen, and mental foramen. These are the three main foramens of the Norma frontalis. You have to remember all these points, mainly the bones, sutures, and the features like glabella, nasal, anterior nasal spine, symphysis menti, and mental protuberance with frontal eminence. And foramens are supraorbital, infraorbital, and mental foramen. This is the complete discussion on Norma frontalis. If you have any doubt, please comment in the comment section. If you like the video, please do like, subscribe to the channel. Namaste.